Welcome to the Transplant Medication Teaching Video Sessions. One of the best ways to keep your transplanted organ working well is to take your medications exactly as prescribed. The transplant team will focus a lot on your anti-rejection medications, but your other medications are also important to your health and to your new transplant. If you have any problems with your medications, including side effects, keeping them down after you take them, getting them from the pharmacy, or paying for them, please reach out to your transplant team. Do not start new medications or stop taking any medications without discussing with your transplant team. Anti-rejection medications, which are also known as immunosuppressant medications, are necessary lifelong after transplant. This is because your body's immune system normally searches and destroys anything that it recognizes as foreign. These are things like viruses and bacteria, but your body will also recognize your transplanted organ as foreign. Medications like tacrolimus, mycophenolate, and prednisone work together to weaken your immune system so that your body cannot recognize your transplant as easily and is less likely to attack or reject your new organ. Because your immune system is weakened by these medications, it also means that you are not able to fight off infections as well as you were before your transplant. To help prevent infection, you may be prescribed anti-infection or infection prophylaxis medications. There will be additional videos for each anti-rejection medication and anti-infection medication that you are taking. Please watch them for more specific information. In addition to the anti-rejection medications increasing your risk for infection, they can also increase your risk for cancer. The cancer that we see most commonly is also the most preventable. That is, skin cancer. After transplant, we recommend that you take steps to protect your skin from the sun by wearing sunscreen with a minimum SPF of 30 and by covering up when you're going outside. We still want you to go out and be active. Just do it in a way that is safe for your skin in the sun. We also want you to follow up with a dermatologist or skin doctor regularly, since skin cancer is easier to treat if it is caught early. Anti-rejection medications are timed very carefully, and it is important that you stick to this timing as much as possible. If your medication is timed twice daily, it is important that you take it consistently at the same time of the day, 12 hours apart. If your medication is timed once daily, it is important that you take it consistently at the same time of the day, every 24 hours. Medication timing is also important for laboratory monitoring of your anti-rejection medication. Some anti-rejection medication doses are adjusted based on blood levels in your body. On lab testing days, blood work should be drawn within an hour before you typically take your morning dose of medications. Once your blood work has been collected, you can take your medications. On non-lab testing days, take your medications on time as prescribed. If you need to adjust the timing of your medications to better fit with your schedule or due to an upcoming procedure, please discuss this with your transplant team. Food can also affect your medications. It is important that you consistently either take them with food or consistently take them on an empty stomach. We typically recommend that you take them with some food to help you tolerate them better. If you were to miss a dose of your anti-rejection medication and realize it within a few hours of when it was due, please go ahead and take the medication and then get back on your regular schedule. However, if you don't realize that you've missed it until your next dose is due, please skip the missed dose and get back on your regular schedule. Do not double up on your dose or try to catch up and make up for the missed dose. Missing doses or skipping doses or taking too much medication can all be harmful to you and your transplant. If you are not sure what to do, or if you miss a dose within a week of your next scheduled lab tests, please contact your transplant team for instructions. You are responsible for keeping up to date on your refills so that you don't run out of your medications. It is a good idea to contact your pharmacy several days before running out of your medications to request your refill, especially if it comes from a mail-order pharmacy or from the Mid-Valley Specialty Pharmacy. After transplant, it is important to keep an up-to-date list of medications. You can use your own system for this, or continue to use the medication list or med planner provided by the transplant team. Please ask the transplant team if you'd like an updated copy of the med planner at your clinic visits. One of the reasons you have a transplant pharmacist on your team is to help ensure the medications are safe for you, safe for your transplant, and safe with your other medications. Before taking any new medications, it is important to ask your transplant pharmacist or transplant team to be sure it is okay to take. This goes for prescription medications, over-the-counter medications, dietary supplements, and herbal products. You should stay away from all herbal products and anything that says it may boost your immune system. If there is a product you'd like to take, please take a picture of the label or bring it into clinic, and a pharmacist can review it for safety. Your provider can also contact the transplant team if he or she has questions about which medications you can take. There are also 2 fruits and juices to avoid after transplant: grapefruit and pomegranate. These fruits and juices make it so your body can't break down some of the anti-rejection medications and may increase your risk for side effects and kidney damage. If you ever need to take anything for pain, the only over-the-counter medication you can take is Tylenol, or its generic acetaminophen. Please follow the label carefully and be aware that it is in many over-the-counter products. The maximum amount of acetaminophen you can take is 3,000 milligrams in a 24-hour period, or 2,000 milligrams if you are a liver transplant recipient. You should avoid medications like aspirin for pain, ibuprofen, brand names Motrin, Advil, and Excedrin, and naproxen, brand name Aleve. Medications like these are known as NSAIDs, and over time, they can damage your kidney. Finally, remember your transplant team is here to help. Please do not hesitate to reach out to your coordinator or transplant pharmacist with any questions or concerns. The transplant pharmacist is available on the hospital floor and will be meeting with you prior to your discharge home, and will also be seeing you in clinic. This concludes the medication overview video.